And first at 5, with COVID-19 cases on the rise again, cities like Austin and Los Angeles are scaling back again. Hi, everyone. Thanks for being here. I'm Jonathan Martin.
And I'm Caitlin Monty in for Rashi Vats. As for whether the Houston area is going to be making any changes in response to a recent uptick in COVID cases, Maria Salazar joins us live after spending the day checking in with many of our officials and health leaders.
Hi, Jonathan and Caitlin. Well, I caught up with Harris County Judge Lina Hidalgo here at Baker Ripley in Southwest Houston as she was here talking about rental assistance. But as for COVID restrictions, she says the short answer is no, but she says she is watching it closely, and getting out of this pandemic, she says, is in our hands.
It is not a moment to say, all the progress is lost by any means. No, but we are in a precarious situation.
Harris County Judge Lina Hidalgo saying it's not time yet to raise the county COVID-19 threat level.
We are looking at the numbers. We're at a place where right now it still makes sense to be at yellow, but we're setting thresholds, and I'm going to be guided by the data.
In mid-May, it was lowered from the highest level, red, meaning there is severe uncontrolled spread, to orange. By the end of the month, it was down to yellow, meaning there is controlled spread. The county's positivity rate is 5.5. It was 3% about a month ago. In the city of Houston,
the positivity rate in Houston 2 weeks ago was 3.3%. That's the lowest that we had gotten to. And then in 1 week, it jumped up to 4.9%. That's about a 48% increase from 1 week to the next.
The city is also tracking wastewater for the virus, where Dr. David Purse says they're seeing an increase in the amount, and they're picking up the Delta variant.
We've been seeing that actually now for several weeks, and this is the usual trend. We'll start seeing an increase in the wastewater about 2 weeks before we start seeing an increase in the positivity rate. And then that's about 2 weeks before we start seeing hospitalizations increase.
Governor Abbott banned local governments from implementing restrictions. Purse says even if they were allowed, it would be nearly impossible.
It's also quite apparent that for people who are vaccinated, they really don't need to have restrictions because the vaccines are highly effective. I don't think that we can go there like we did before, only because it'd just be operationally impossible. But restrictions absolutely work.
Both leaders are urging those who haven't gotten the vaccine to do so.
If you don't have it, you are definitely in the minority, and you are extending the suffering of this virus in this crisis, including the economic pain.
And Dr. Purse, as well as hospital leaders that I talked to this week, says although hospitalizations are increasing, they do not expect them to be near those levels that we saw during the first two waves. And we also reached out to Governor Abbott's office to see if they had anything they wanted to address in terms of what can be done to lower the levels, and we have not heard back yet. Reporting live in Southwest Houston, Maria Salazar, Fox 26 News.